some suggestions and some selection guide for how to choose a proper support surface for our users or for our caregivers. So this is today's information. We hope that everyone could enjoy the session. So in the very beginning, that we will all know that for the pressure injury, once we have the pressure injury, it takes time, takes money to recover. Therefore, we know that prevention is pretty important. So for the prevention part, that for support surface, it is one of the elements to help to assist the patient to prevent the pressure injuries. So based on the guidelines, there are some key considerations to mention that what we can think about for our users when we are trying to let them select a proper support surface for our users. Here are some considerations. For example, first we could assess the pressure injury risk. Okay, and second, we could also check if the patients, they have the existing pressure injuries wounds. If yes, we could check the pressure injury categories. And we could see if the patients, they are able to offloading some pressure injury wounds, or some pressure point. And also we could assess the risk of deterioration, which means that their wounds gets worsening. If there are any risk, even though they are already receiving a good professional, like complete cares, if there are still some risk that their wounds gets worsened. Okay, so based on these factors, generally we have summarized a flow chart of our users, okay, to see, okay, in which kind of the situations the patients could, we might suggest them to use the air matrix. So first, following the considerations, first, let's go to the first element. We can check how about the patient's pressure injury risks. Of course, for this part, we can follow the like the standard scale for Brendan scale. If their Brendan scale is more than 18, we think that they might not have that much pressure injury risk. So of course, when they go to the hospitals, they could still use their standard hospital matrix. However, as long as the patient has the pressure injury risk, for example, their Brendan scale is less than 18 score, then we could start to think about the second element. If the patient already has the pressure injury wounds. Okay, so if yes, then we could still to check their pressure injury stages. Okay, so if the pressure injury wounds are pretty severe, maybe in stage 3, stage 4, or maybe like deep tissue injury, then we could suggest them to use an alternating pressure air matrix, especially for the replacement one. So for example, like this one, we have the like higher air cells or the double layer air matrix, so that the functions that could prevent the patient have bottoming out risks. Okay, so for this one, if we have already have the wounds and the wounds are with the severe levels, we could suggest them to use the replacement air matrix. Okay, and let's come back to here. If the patient also have the wounds, but the category is less, maybe just stage 1 or stage 2, or the patient does not have the pressure injury wounds, then we could check their pressure injury level, risk level again. Okay, so following the Brendan scale, like for the risk, maybe like for high is during 10 to 12, moderate 13 to 14, mild is 15 to 18. Okay, so if the pressure injury risk level is severe, then also we could suggest them to use alternative pressure air matrix replacement kind. However, if the PI risk level is mild, the score is just like around 15 to 18, then we could suggest them to use the high-spec foam. At least they have the reactive foam matrix and to do the pressure redistribution, or the non-powered hybrid previously Kuneva mentioned about the hybrid matrix. It is like this one combining the air cells and the foam matrix together. And without the pump, it could also like the reactive support surface. Okay. However, if the PI risk gets higher, or the patient has the risk that their wounds gets worsened. So in this way, we could also suggest them to use the alternating pressure air matrix, but with like the overlay. What kind of what does overlay means? It means that the air cells are a little bit lower, so we need to put another foam matrix under, so that to prevent the bottoming out. That's called overlay. Okay. Or we could also suggest them to use like the hybrid matrix, but with the power, so that it could provide at least some alternating function. Okay, so for the patients, for the users, we can follow their pressure injury risk or their wounds and to do some suggestions for them. And however, we know that even though we mentioned alternating pressure air matrix, but we see that on the market, there are lots of models of the air matrix. How can we try to select a better one for our users to fit their needs, or to fit the needs of the caregivers? We know that the stationaries in hospital, everyone are pretty busy. How we can select the most proper one to fit both the needs of the caregiver and for the users. So in this way, we can see Wellell offers lots of the air matrix. For example, the Dumas series, and of course, Optima Turn, Optima Prone, and also we have crossover, the hybrid one. So before we are thinking how we can suggest our patient, our users, or our caregivers to choose a correct matrix, first we can understand some design ideas of the support surface. Except for the pressure injury prevention. For pressure injury prevention, based on guideline, it mentions that for the support surface, it is designed to redistribute pressure and reduce friction and shear, and add microclimate management. So generally, for the support surface on the market, at least we have these functions. First one is for pressure redistribution. And microclimate management, also CONAPO mentioned this for the 2025 guideline. It mentions the importance of microclimate management and also shear force management. Okay, and except for that part, what's more, we can also think about the patient comfort. So there are also some design concept for the patient comfort, and also some designs to reduce caregivers' workload. Okay, so we can combine these designs and thinking for our caregivers and our users. So I think first, before our selection guide of our Wellell support surface, we can let everyone know about the design concept. So I think these two are more for the pressure redistribution part. Everyone shall be more familiar with this part. So for reactive one, what's reactive? How we can redistribute our pressure with reactive matrix. Okay, so I think here is one example everyone is pretty familiar with. Like when we are holding a baby, there are lots of contact areas with the babies, right? So we will feel, warm and comfortable. However, everyone has some experience that a baby step on your belly, right? So the same force, the same body weight of the baby, but the contact area is only their little cute feet. So it will cause the pressure more. Okay, so for reactive support surface, the concept is that we can use the immersion and envelope. So when patient lie on the mattress, when they sink into with the immersion and envelope, we try to broaden the contact area. So in this way, the pressure could be redistributed to a broadened area and to relieve the pressure point of their body. So for reactive support surface, of course, we can see on the market like reactive one, non-powered, and also reactive but powered. Okay, so generally for reactive powered, later you could see there are some mode called CLP, continuous low pressure, and everyone could try the function later. Okay, and the second one, I think everyone's familiar with this one. It's called active support surface. So it uses deflation, inflation, deflation, inflation to do the pressure redistribution. In this way, like for the inflation one, the air cells gives the support so that the deflation one, the point, the pressure can be relieved. Okay, so this is called alternating. And for globally, like the alternating cycles, the most frequent cycle is with 10 minutes, which means that the air cells could be inflate for 5 minutes and deflate for 5 minutes, so that the blood of the tissue could be refilled again, so to decrease the pressure injury occurrence. Okay, so this is called alternating mode. And what's more than the alternating? So we also have some functions for designed for the patient's comfort. So for also it is called alternating, but we could decide with lower difference of the amplitude of the pressure when inflation and deflation. Why we have these designs? We can think about that because the difference is less. So the patient, they might feel more stable when they are lying on the mattress. Okay, so for example, some patients, if they are more sensitive or they have like critical ill, they might feel pain. For these patients, to increase their comfortable, we could suggest them to use like alternating low pressure mode, this kind of alternating function. Okay, so these are the two basic and the most frequently seen functions of the pressure redistribution. Other designs to relieve the pressure point, of course, we could see the most clear one to offload the pressure point directly. So for example, we know that the most frequent pressure injury wounds places, one is at sacrum, second is at the heel part, right? So for the air mattress, we could have the design to offload the heel part. Later, we could try on the demo part. Okay. Another part is our Optima prong that previously Dr. Carjon already demonstrated to everyone that we have a socket at the face part. So that's also a design to offload the pressure point and also the individual deflation valves. Okay. So these are the designs to offload the pressure point. Others, we also have other designs, like for the air cells shape. Why we make it like rectangular, like cubit, or why we make it round. Like so, for example, we have our Optima turn, the trunk part, and for our Optima prong, it is with the rectangular air cell. So that when patient lie on our mattress, their body can lie on the mattress more evenly. So the pressure could be separate in broadened areas. The pressure could be lower. So this is also the designs for redistribute the pressure. Others that for the very high risk patients, for example, our Optima term, not the whole mattress we give the same pressure in the air cells, but we separate 3 zones. It's called like multi-zone pressure adjustment. So we can separate into the head zone, the trunk zone, and the lower leg zone because of the different weight of these different areas. So generally, we could separate, offer different inner pressures in the air cells and to provide better immersion and envelope for our users. Okay, so this one, if we have very severe high risk pressure injury patients, then we could suggest them to have the multi-zone air adjustment matrix. Okay, so others, like for prevent bottoming out. Okay, so we also know that prevent bottoming out, if we already find the bottoming out situation, it means that the pressure redistribution is not enough. We need to adjust or we need to replace the mattress, right? So also for air mattress, we will have some designs to prevent bottoming out. The most simple one, of course, we can add the foam-based pocket. It's like the overlaid matrix, or we have the seal-on-seal design for our replacement. So the upper layers, they could do alternating, but lower layers, they will keep some pressure to prevent bottoming out when patient lying on the mattress. Okay, so except for these two designs, there's also another design that many mattress has. It's called seat inflation. What does it mean? We know that when we are lying and we sit up, the pressure at our sacrums are different. So for the seat inflation on the market, the product has this function. Generally, when patient sits up, they will add a little bit more pressure for the whole mattress to prevent bottoming out during sitting. Okay, so if you see on the market, sometimes the seat inflation, you can manually select, like Optimator, later you can try it, like you can manually boost it, or they have the auto sensor. They could sense that when the bed head part is raised more than 30 degrees, then you automatically to add some pressure. Okay, so it is auto seat inflation, like this one. Okay, so these are some designs to prevent bottoming out. Okay, others like microclimate management. Generally, for the mattress, we have two functions to help to assist the microclimate management. The first one is called low air loss. So with low air loss, you can see sometimes the laser coatings are at the air seal part. Sometimes the laser coatings at the side tube. So you will see some small cuttings later, and you could try to find it later. And then after that, some air could come out and help to arrange the microclimate inside the mattress. Also, for the top cover also is also crucial for our users. So based on guideline, they mentioned that if for the support surface, the top cover, their moisture vapor transmission rate, MVTR, guideline recommend that the value shall be more than 300 grams square meters in a day. So generally, like for our products in Wellell, our top cover are always the MVTR rate more than 500, which means that when patient lying on our product, their moisture and temperature could be better in a better situation with when they are using the mattress. Okay, so this is for microclimate management. And the last part, generally for the shear force, it is also pretty crucial for our top cover. So top covers, if for the entry level, sometimes you will feel the top cover is not stretchable. But generally for higher levels, they are for the more high risk patients. So generally, the top covers, they are stretchable. So later you could also try to stretch it in bilateral directions to feel the tension of it. And with the stretched top covers, it could assist to decrease the friction and shear force. Of course, when sitting up, the auto seat inflation, it gives some pressure to support the patient. It could prevent the patient to slide down. This also helps to prevent the shear and force. Okay, so these are some designs that we have for the mattress to improve the pressure injury prevention part. So based on this, what's more than the pressure redistribution part, how we can have the design to provide better patient comfort. So there's also one design called the rhythm of comfort. So for the rhythm of comfort, it's during the inflation and deflation. When inflation and deflation, sometimes entry levels, patient might feel a little bit dizziness because of the movement. Okay, so for the higher level of the mattress, generally the deflation air cells will go back to the same level, and then the other air cells will go down, which means that the patient will generally feel more stable on their surface because every time the cells will go to the same level and then move, same level and then move. So for patient who needs comfort, they could choose like our mattress with the rhythm of comfort, like this one. Others, for caregivers' workload, we must emphasize auto function. For example, auto, when patient lie on the mattress automatically give the proper pressure to support the patient. Or we place the connector to the pump can automatically recognize which mattress, if it is wrong or if it is right. Okay, and when we press max firm, it can also automatically go back to the previous mode after the nursing cares. So these are auto designs are all for the reducing our caregivers' workload. What's more, of course, for turn, we know that reposition is important. From Bangna, we know that even though we are using the support surface, we cannot skip the repositioning part. So we know that every 2 to 4 hours, we need to assist to do the reposition. However, it is cause a lot of labor, and some nurses or caregivers, they might feel low back pain during the repositioning. So also we could provide like automatically turning systems. They could assist to reduce the the caregiver's workload during repositioning the patients. And we could have that tried during the workshop. Okay, so with all these functions, now we can go back to our clinical scenario. Okay, come back to our clinical scenario to see how we can choose a good one based on our needs and our patient's needs. So first, we could think about this scenario. If the nursing stations in the world, they are pretty busy. How to say they are pretty busy? We can see the first condition. If the nurse to patient, one nurse need to take care of more than 6 patients in a time, it's pretty busy. And caregivers, they are unfamiliar with support surface. They haven't tried the support surface before. Or the environment, they need frequent patient turnovers. For example, some operation rooms or some short-term inpatients, which means that the nurses, they might not have time to learn this device. So if 2 of the 3 conditions are fit, then the first function we could suggest is with the auto pressure adjustment. It will be quicker. We only need to transfer the patient onto the bed. Okay, and if after the auto pressure adjustment, then we can think about the patient's need. If the patient, they already have multiple pressure injury wounds, which means that they would need a better pressure redistribution product. So in this way, we could consider about with the mattress with the multi-zone pressure redistributing part and also with the individual air cell. So in this way, it could provide the patient a better pressure relief options. Okay, but if not, the patient is still okay, but they need comfortable feelings, then we could choose another design that which can offer the comfort designs. For example, alternating low pressure and the rhythm of comfort. For example, our ProCare Auto series. Okay, so these are the flow chart that we could think about for our caregivers and our nurse. And let's come back to the clinical scenario. If only one conditions of the previously mentioned criteria only met for one conditions, then we could think about if there's enough steps to perform turning. If not, of course, we could suggest them to use the automatically turning systems. If yes, they have enough steps, but the patient, they are not able to be repositioned. They might move sometimes the patient with dilemma or some dementia patients, they could not follow the repositioning procedures. Then we could also use the optimal turn to let them feel more comfortable. However, if they have enough people to do the turning, also the patient can follow, then we could consider about the patient's pressure injury risk. If they need to stay on the bed for a longer time, they have the higher pressure injury risk, then we could suggest them to use the replacement air mattress. If it's only have a lower risk, like for some elders, they still have a little bit mobility, but they do not have good nutrition, or their body is like retiring. Like this kind of patients, we could at least suggest them to use the entry level of the air matrix, like the overlay one, to provide the entry level of the pressure redistribution function. Okay, so this is the whole flow chart that we summarized based on the design, based on the guideline recommendations. Okay, so I think that's all for my sharing informations today, and I hope everyone enjoyed it. Thank you.